Imagine waking up 7 mornings from now, shuffling to the bathroom and watching your blood pressure monitor display a number that's dropped more than it has in the last 3 years. Not because your doctor doubled your prescription, not because you started some brutal 5 a.m. boot camp, simply because you changed 7 specific things on your plate. Adjustments that target the real root of hypertension, the part your pills never touch. I'm Dr. Kevin Adewale. Over 2 decades treating patients past 50, I've seen men walk into their cardiologist's office and leave with their medication dose cut in half, not because they demanded it, because the numbers gave the doctor no other logical choice. Today, I'm giving you exactly what those men did. But before we dive into the 7 foods, I need you to hear something critical. About halfway through this video, I'll reveal 3 everyday items, things probably sitting in your kitchen or bathroom right now that are silently sabotaging every pill you take and every healthy choice you make. If you click away before that section, those 7 foods will deliver maybe 30% of their real power, so stay locked in. The second half might be the most vital health information you've encountered in years. Let's start with the biology your doctor likely skipped. Your artery walls produce a molecule called nitric oxide. Think of it as your body's natural pressure release valve, a chemical messenger that tells the smooth muscle around your blood vessels to relax and widen. When those walls ease up, blood flows with less friction and your pressure drops. Your arteries speak a language your medicine never learned. The problem? After age 50, your natural nitric oxide production falls off a cliff, and most blood pressure treatments, including medication, never address this underlying collapse. The 7 foods I'm about to share all work on this exact pathway. Some deliver nitric oxide directly, some shield it from destruction, and one actually triggers the enzyme that builds it from scratch inside your body. Let's start with number 1, beet juice. Beets pack more natural nitrates than almost any vegetable. When you drink beet juice, those nitrates travel to your mouth, where friendly bacteria on your tongue convert them into nitrite. That nitrite enters your bloodstream and transforms into active nitric oxide. Your arteries essentially get a chemical signal to expand, right on command. A study in the journal Hypertension found that drinking just 1 small glass of beet juice daily dropped systolic pressure by an average of 8 points within hours. Here's your protocol. Every morning, drink 250 milliliters of beet juice, about a small cup. Room temperature matters. Cold juice slows down that nitrate conversion process in your mouth. If the taste is too earthy, mix in a splash of apple juice. Give it at least 2 weeks before you recheck your numbers. Now, beets get all the fame, but the next food actually contains even more nitrates per bite, and most shoppers walk right past it in the produce aisle. Arugula. Those peppery leaves, arugula works through the same nitrate pathway as beets, but adds something beets lack in high amounts: potassium. Potassium tells your kidneys to flush out sodium instead of hoarding it. When sodium builds up, it pulls water into your bloodstream, increasing total blood volume. More volume, more pressure. Potassium is nature's sodium neutralizer, and most people over 50 are dangerously low on it. Add 2 big handfuls of raw arugula to 1 meal daily. A simple salad with olive oil and lemon is perfect. And here's the non-negotiable part. Don't cook it. Heat destroys both the nitrates and the potassium bioavailability. Raw is the only way. The third food raises a question you've probably never thought to ask your cardiologist. What if a common tea worked through the exact same mechanism as a class of prescription blood pressure drugs? Not similar, identical. It's a flower. Hibiscus. Hibiscus tea contains compounds called anthocyanins and organic acids that block an enzyme known as ACE angiotensin-converting enzyme. ACE inhibitors are among the most prescribed blood pressure meds worldwide. They work by stopping your body from making angiotensin II, a hormone that squeezes your vessels tight. Hibiscus does the same thing naturally. A meta-analysis in the Journal of Nutrition covering over 500 patients found that regular hibiscus tea lowered systolic pressure by an average of 7.5 points. Steep 2 teaspoons of dried hibiscus flowers in 1 cup of hot water for 8 to 10 minutes. Drink 1 to 2 cups daily. Important warning, if you're already taking ACE inhibitor medication, talk to your doctor before adding hibiscus regularly. The combined effect could drop your pressure too low. That's not a reason to avoid it. It's a conversation to have with your physician who should know you're using this. The fourth food is something everyone has heard of, but almost everyone uses it wrong. The mistake is all about timing Gora garlic. When you crush or chop a garlic clove, you start a chemical reaction. An enzyme called alliinase turns a compound called allicin into allicin. Allicin is what gives garlic most of its heart benefits. But it doesn't stop there. Inside your body, allicin further converts into hydrogen sulfide, another gasotransmitter, just like nitric oxide, that tells your blood vessels to relax. 2 gases, 1 clove, double the relaxation. The mistake, cooking garlic immediately after crushing. Heat kills alliinase within seconds. No enzyme, no allicin. You get the flavor, but zero cardiovascular benefit. The correct method, crush or finely mince 1 to 2 raw cloves, then wait 10 minutes. That waiting period isn't optional. It's chemistry finishing its job. After 10 minutes, eat it. Mix into salad dressing, spread on avocado, whatever works. 10 minutes. That single change turns garlic from a seasoning into a therapy. Before we move on, quick question. Do you eat garlic regularly? And when you prepare it, do you cook it right away or let it sit? Drop 1 or 2 words in the comments. I'm genuinely curious how many of you have been doing this correctly without knowing why. The fifth food has the strongest long-term clinical data of anything today, and I want to be exact about what the research actually proves. Ground flaxseed. A randomized controlled trial in the journal Hypertension followed patients for 6 months. One group added ground flaxseed to their daily diet, the other didn't. At 6 months, the flaxseed group showed an average systolic drop of 15 points. 15 points sustained half a year. That's comparable to some first-line hypertension drug. The mechanism isn't one thing. It's several working together. Flaxseed provides alpha-linolenic acid, an omega-3 that cuts arterial inflammation. It contains lignans, plant compounds that influence hormonal pathways tied to vessel health, and is loaded with soluble fiber that improves your gut microbiome in ways that measurably help your heart. Pro Talk. 2 tablespoons of ground flaxseed daily. The word ground is critical. Whole flax seeds pass through your system mostly intact. Your body can access the active compounds without breaking the seed open. Mix into yogurt, smoothies, or oatmeal. The taste is mild, almost unnoticeable. The catch? You need 3 to 4 months of consistent use to see the full effect. This isn't a quick fix. It's cellular level change over time. But consider this. 3 months from now will arrive whether you start today or not. The 6th food will raise some eyebrows. Let me give you the mechanism before you judge dark chocolate. Minimum 85% cacao. Cacao is one of the richest sources of flavonoids, specifically a subclass called flavonols. Flavonols activate an enzyme called endothelial nitric oxide synthase, the very enzyme your artery walls use to produce nitric oxide from scratch, not from dietary nitrates, but synthesized internally from an amino acid called arginine. So with beets and arugula, you're supplying raw materials through the nitrate pathway. With dark chocolate, you're flipping on the factory, that builds nitric oxide through a completely separate route. A meta-analysis of 24 clinical trials found that regular high flavonol chocolate consumption produced measurable reductions in both systolic and diastolic pressure across many populations. Protocol: 20 to 30 grams of dark chocolate daily, roughly 3 to 4 small squares. Minimum 85% cacao. Higher percentage means more flavonols and less sugar. This is not a license to eat a whole bar. The therapeutic dose is small but potent. The seventh food works differently from every other one we've covered. All six before either create nitric oxide or stimulate its production. This one protects the nitric oxide you're already making from being destroyed before it can do its job. Pomegranate juice, nitric oxide is a fragile molecule. Free radicals produced by inflammation, oxidative stress, poor sleep, and processed foods. Tear it apart before it can reach and relax your artery walls. You could eat beets every morning, arugula at lunch, and dark chocolate in the afternoon, and still have low nitric oxide activity if your oxidative stress is high enough to kill it faster than you make it. Pomegranate contains some of the most powerful antioxidants found in any food, including a unique compound called punicalagin. Research shows it's more effective than red wine or green tea at neutralizing the specific free radicals that attack nitric oxide. A clinical trial in clinical nutrition found that pomegranate juice consumption lowered systolic pressure by an average of 5%, while simultaneously increasing measurable nitric oxide levels in the bloodstream. Protocol: 150 milliliters of pure pomegranate juice daily. Look for no added sugar and no from concentrate. Both slash the polyphenol content. Think of pomegranate as the shield that protects all the work the other 6 foods are doing. Now I need your full focus, because for a significant number of people watching, none of what I just described will reach its full potential. Not because the foods are flawed. The research on everyone is solid because of 3 things hiding in your daily routine that are systematically dismantling the biology we just spent 15 minutes building. The first one will surprise you. Your mouthwash. I know. Stay with me for 30 seconds. Remember those friendly bacteria on your tongue that convert dietary nitrates from beets and arugula into nitrite and then into nitric oxide. That process requires specific bacterial species living in your oral microbiome, antibacterial mouthwash, the kind marketed as Kills 99, 9% of germs, and cannot tell the difference between harmful bacteria and the beneficial nitrate converting bacteria your cardiovascular system depends on. It wipes out both. A study in free radical biology and medicine found that using antibacterial mouthwash twice daily reduced nitric oxide bioavailability by 25%. Think about what that means practically. You drink your beet juice every morning. You eat your arugula at lunch. Then you rinse with antibacterial mouthwash, and you've just eliminated a quarter of the cardiovascular benefit you worked to create. The fix is not to stop brushing your teeth. Switch to a fluoride-only toothpaste. Brush thoroughly without an antibacterial rinse. If you use mouthwash at all, choose a non-antibacterial formula or simply rinse with water after meals. Your oral microbiome is not separate from your cardiovascular system. It's part of it. The second saboteur is what most of you ate this morning: cereal, orange juice, white toast with jam or butter. These foods, refined carbohydrates, cause a rapid spike in blood glucose. Your pancreas responds with a surge of insulin. But insulin has a secondary effect on your kidneys that almost no one talks about. It signals them to retain sodium instead of excreting it. Sodium retention increases blood volume. Increased blood volume raises the pressure your heart must generate to push that blood through your arteries. This is a huge reason why blood pressure spikes most sharply between 6 and 10 in the morning. not just because of natural cortisol rhythms, but because of what the majority of people eat for breakfast. The practical change: shift your morning meal toward protein and fat, eggs and avocado, Greek yogurt with walnuts and ground flaxseed, which you are already taking anyway, smoked salmon with cucumber. Foods that digest slowly, produce a minimal insulin response, and allow your kidneys to stay in sodium excretion mode through the highest risk hours of the day. This single change, just breakfast, can meaningfully reduce your morning blood pressure peak. And that peak carries the highest cardiovascular risk. Before I tell you the third saboteur, let me ask you directly, what does your current breakfast look like most mornings? Toast and coffee or something different? Leave a comment below. I'm not asking to judge. I'm asking because the pattern in those responses tells me what people need to address first. And I do read these comments. The third saboteur is something that may seem completely unrelated to your blood pressure: your pain medication, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, high-dose aspirin, among the most common medications in the world, especially for people over 50 dealing with joint pain, back pain, or recurring headaches. And they interfere with blood pressure control through two distinct mechanisms. First, NSAIDs inhibit prostaglandins, hormone-like compounds that promote sodium excretion and blood vessel dilation in the kidneys. Block prostaglandins, and your kidneys hold on to water and sodium. Second, NSAIDs partially block the mechanism by which several classes of blood pressure medications, including ACE inhibitors and diuretics, do their primary job. So you could be taking your prescription faithfully, eating all 7 foods I've described, and then popping ibuprofen twice a week for a sore knee, partially undoing the entire system with a single dose. The alternative worth discussing with your doctor: acetaminophen for pain management when appropriate, since it doesn't carry the same cardiovascular interaction profile. If you're taking regular NSAIDs for a chronic pain condition, this is not information to act on unilaterally. It's a conversation to have with your physician at your next appointment, not optional. Now let me close the loop I opened at the beginning. Why morning specifically matters more than any other time. Between 6 and 10 a.m., there's a natural surge in cortisol and catecholamines, your stress hormones. This produces a predictable and significant spike in blood pressure. Cardiologists call it the morning surge. And statistically, more heart attacks and strokes occur in this 4-hour window than in any other comparable period all day. Your morning routine either amplifies that surge or dampens it. The protocol I've described today works in both directions simultaneously. Beet juice and garlic taken in the morning flood your system with vessel-relaxing compounds exactly when your arteries are under the most pressure. The breakfast shift removes the insulin sodium mechanism that adds extra force to the morning surge. Eliminating antibacterial mouthwash preserves the oral bacteria that convert those morning nitrates into active nitric oxide before your blood pressure peaks. These are not 7 separate tips you can pick and choose from. They form one integrated system designed to address high blood pressure from multiple biological angles at the same time. Your medication manages the downstream result. This protocol addresses the upstream mechanisms your medication was never designed to reach. If this approach makes sense to you, there's a critical second layer worth understanding: the role of specific mineral deficiencies, particularly magnesium, and how they determine whether everything I described today works efficiently or barely works at all. I covered that in depth in another video. The link is in the description. If this video gave you something useful, a like takes 2 seconds and genuinely helps other people who are searching for this information find it. Subscribe to Winds of Thought if you want the next part of this protocol next week. And as always, review any dietary changes with your doctor, especially if you're managing hypertension with medication or have any underlying conditions. This information is designed to work alongside your medical care, not as a replacement for it. I'll see you in the next one.